Magandang araw po sa ating lahat and welcome to the overview of public health in the school setting, brought to you by the Department of Education, USAID, RTI International, and the Philippine Society of Public Health Physicians. This quick overview course on public health in the school setting is meant to build the capacity of school health program decision makers and implementers to inform and guide school reopening and help ensure the health of the learning community in a late stage pandemic or post pandemic setting. So, the first part of this course will be refreshing and updating the knowledge regarding public health programs in the school setting and the common health concerns of students and promoting a healthy environment in our schools. So, for the first lecture, it will be about public health in schools, and it will be delivered by me. I'm Dr. Michael Campued, the president of the PSDHP. Before we begin, I think what's important is for us to first understand what is public health. So, public health is the science and art of preventing disease, prolonging life, and promoting health through organized efforts and informed choices of society, organization, public and private communities, and individuals. Public health as a field of practice deals with communities, populations, and the prevention of diseases. So we're all familiar on how clinicians treat diseases and injuries one patient at a time. So for us, public health practitioners, we come up with solutions to benefit the community at large and address root causes of disease and disability. Public health practitioners essentially adopt multi-sectoral approaches and collaborate with other sectors to create and implement policies, programs, and interventions. So a prime example of a health policy of the Philippines is the Republic Act 11223, or the Universal Healthcare Law, which provides you an example of multi-sectoral approaches to health. So moving forward and trying to understand now schools in this sense of public health, we first have to define what is school health. So school health is the comprehensive efforts of developing, implementing, and evaluating services both within the school and the community that provide each and every student with resources to thrive within a healthy environment. So school health in itself is a health system, which is designed to promote health, wellness for students. And school health considers health concerns within the school, as well as the prevention of causes of illness, injury, disability within and outside school premises. So a distinct feature of this, of course, is that it deals with the population of students and its close linkages with the families of students and other providers surrounding them. So within the Philippines, school health encompasses the provision of medical, nursing, dental services to students, as well as other services for disease prevention and control. It also includes nutrition, prevention of substance abuse, and some examples include like the Oplan Kalusugan annual program. Now, if we begin to talk about the components of a health system, WHO was able to provide a good framing, and it talks about the 6 building blocks. These 6 building blocks of a health system are easily translatable within the school health system. So, in terms of understanding these particular building blocks can be adapted or readily mobilized, to special situations such as school health. In this particular case, it deals with the population of learners at the center of it, of the 6 pillars. And when we begin to describe how these pillars are being implemented, we can begin talking about health governance as the leadership of administrators, health providers, and decision makers. Health information, which is about the collection, the management, and dissemination of data of students and programs. And access to medicines and technology are about the commonly used medications and equipment, at this case, primarily for primary care. And human resources for health will be those school health providers, educators, and even the support staff. In terms of health financing, it talks about the budget allocation and management of finances for school health, and service delivery are the programs and facilities for delivering school healthcare. And as pandemics evolve, the descriptions to these components will continually change and adapt to suit the needs of the community. And it is as important as well to pay attention to the relationships between these six pillars. Now, there are also roles for different people within the school health system. And the Department of Education does not limit the school health system only to healthcare providers or point persons. No? Part of the school health system are the teaching staff who directly interface with students, as well as administrators who help decide school policies and serve as the link between individuals and the districts of the region-wide or nationwide programs. So within pandemics, their roles evolve, and we can begin seeing that students can take on an active role in self-reporting of their symptoms. The teachers who can be points of contact that can be trained as first responders or health educators. The administrators who direct school programs can also interface with the local community for a more effective response. The medical staff or the point persons for care can learn to manage new presentations of cases and also participate and aid in safe school reopening. Meanwhile, the non-teaching and non-medical staff can be effective partners in risk communication and also infection prevention and control. And the families can be participants in the care outside the school setting and also participate within school health programs. And the LGU or the barangay health workers who are often seen outside the system can more strongly coordinate with the school regarding surveillance, protocols, and the plan for safe resumption of school activities. So, to summarize, the key lessons that we have learned here include the definition of public health and school health. And we have to also remember that the scope of school health deals with a set of population consisting of learners, educators, and non-teaching staff essential to the learning community. And as pandemics evolve, and return to a new normal can be imminent, the components of public health and school health systems will continually change and adapt to suit the needs of the community. And within special situations like the COVID-19 pandemic, the roles of each person in the system become more diverse and require more cooperation to ensure health and safety of the school community as a whole. Thank you. And this is our lecture 1.